With asthma may have difficulty breathing when they are exposed to certain substances or conditions called triggers. Common triggers include exercise, temperature extremes, air pollution, strong odors, allergies, respiratory infections, and stress. Exposure to the trigger causes the airways to swell and become narrower, making it harder for air to move in and out of the lungs. Signs and symptoms of an asthma attack are similar to those of any other breathing emergency and include wheezing or coughing, rapid shallow breathing or trouble breathing, being unable to talk without stopping for a breath in between every few words, anxiety and fear, sweating. A person with asthma can minimize the frequency of asthma attacks by avoiding triggers and taking prescribed long-term control medications. But when an attack occurs, prompt action is needed to open the airways and restore normal breathing. The person will most likely have a prescribed quick relief or rescue medication to use in the event of an asthma attack. Encourage the person to use his or her quick relief medication as directed by his or her healthcare provider, assisting if needed and state or local regulations allow. Call 911 or the designated emergency number if the person's breathing does not improve within 5 to 15 minutes after taking the medication, or if the person becomes unresponsive. Monitor the person's condition until the person is able to breathe normally or until help arrives.
Okay, so that is our segment on asthma. So, one of the things is we want to pay attention to triggers. If we can prevent triggers, that would be great. A person with asthma may take a quick relief medication to stop an asthma attack. These medications work quickly to relieve swelling, opening airways right away, and are often administered through an inhaler. So those airways are called bronchi and bronchioles. Bronchi are your main airways, bronchioles are your smaller airways, and that medication opens them up. So when we go through sample, and they get to that, if you're looking at the signs and symptoms, maybe you skip over allergies. Oh my God, you're having trouble breathing. Are you okay? No, I have asthma. Can I get you an inhaler? If they say no, I don't have it with them, boom, you got to call 911. If a person requests your help using the inhaler, shake the inhaler, remove the mouthpiece, cover and attach the spacer if used. Give the inhaler to the person and advise the person to use it as directed by his or her healthcare provider. If the person's breathing does not improve within 5 to 15 minutes, call 911 with a designated emergency number. While you're waiting, check the expiration date. Okay? If it doesn't improve in 5 minutes, if that inhaler is expired, it's not going to work. Don't use somebody else's inhaler too. It has to be that person's inhaler. If the person becomes unresponsive, well, then you're starting CPR. Make sure that 911 or the designated emergency number has been called. Begin CPR immediately and use an AED as soon as possible. So I'm going to add some text to Schoology. We're going to answer questions on this. Good luck.